have a hard time wrapping their head around, how do I see a doctor out of my home? Here we are in the time of coronavirus. Hopefully you took my advice a couple of weeks ago and stocked up or staying at home. If not, hopefully you took the advice of the CDC this week and you've stocked up and you're staying at home. Viewers of this channel, 55 and older, heart disease, insulin resistance, diabetes, we're the guys that are most at risk, so we need to let coronavirus go through the population. Now, how do we get health care? It occurred to me that I probably should offer more. I should open up a little bit more. I've been fairly restrictive with my practice and focused on prevention consultation only. For this time period when us boomers and the subscribers to this channel are holed up trying to stay away from coronavirus, I decided to go ahead and open up my practice a little bit more, so the doctor is in. I started to help people understand, because when I talk to patients, they tend to sort of have a hard time wrapping their head around, how do I see a doctor out of my home? You're just not used to that. Again, we're all going to get used to that a lot better than we did before. One of the good things that's going to happen out of all of this is that our generation is going to get used to telemedicine. It's very important and it's been needed. I've been in telemedicine for over a decade. I've run or helped run a couple of the leaders in telemedicine. I was the chief medical officer for MDLIVE for a couple of years, over 800 docs at that point, the number 2 telemedicine company in size. And I'm the quality and startup consultant for K-Health. K-Health is actually incorporating telemedicine with artificial intelligence. So those are all moving ahead, but one of the biggest problems is the boomer generation's just not used to telemedicine. Now I started to develop a deck to help us understand a little and get you a little bit more used to this. As I got to the electronic health record, I thought, you know what? Why don't I just take you inside? So that's what we're going to do. I'm going to take you inside our electronic health record. It's very simple. All I have to do is go to Google, and as you see, when you go places a lot, they start popping up down here. We use Practice Fusion. Practice Fusion is a very popular electronic medical record for docs within the US. So I click on that, then I go over here to log in. As you can see, it's already worn a groove there because that's how we see, record our patients, and order medications. Now, because there's a little bit of a narrow window, I have to move things around to show you how we navigate. Again, it's just coordinating the technology. As I move this over, you see there's a navigation page within Practice Fusion. Home, schedule, we don't use that. Tasks, there's tons of them. Laura Lynn and Michelle use that some, but what I do is I go to the charts. Now, I thought, well, how can I show you a chart? I can show you mine. I've been seen by our practice. And all I have to do is enter Thomas Brewer. My name pops up. And you'll see things about, okay, here's my profile, Thomas Ford Brewer. Date of birth, 6/27/57, Social Security number, which is grayed out. And again, basic insurance, things like that. The pharmacy that I go to, because we have a prescribing program. We go ahead and enter information for our patients. It sends automatically to your pharmacy. Now here's another place to go. As you see, on timeline, we have appointments, documents pending, documents signed, e-prescriptions, as I mentioned before. Let's go to documents pending. So here's my CIMT from 11/19 of last year. As you see, I've shared the results of the CIMT many times. I'm 62 years old. My arterial age is 55. Remember, it started 3 or 4 years ago. At age 72, I dropped some weight. I started managing discovered I had insulin resistance, started managing that. and I broke down and started taking a statin. But again, this is not so much about my case. This is about helping you understand how our electronic health record works. So here's my labs. It starts off again, this is however Quest sends those labs back. But again, I've shared these labs in the past as well. I've got a good ratio here of triglycerides over HDL. It's actually 1/2. But my HDL could be a little bit better in terms of size and population. Remember, that's the time I had that elevated CRP. I've always had perfect inflammation panels, but about a month before this test, what was the date for this? 10/24/19. About late September, early October, that's when I caught that flu-like illness down in Nashville. So that's why I had that elevated C-reactive protein. But as you can see, we've got all the information we need right here in the medical chart. Other information that we might have would include oral DNA. This is a test of the bacteria within your mouth. When I first started off, I had a lot of stuff up here in the high-risk pathogens, some stuff here, and made some very positive improvements. So again, as you see, we have the information that we need to review a patient. Maybe notes from times that I've been seen before. Have I been seen before? Yeah, let me go back. They say the doc that sees himself has a fool for a patient. I have to admit I've seen myself for a few times, so I'll leave that alone. Let's go back and look at encounters. I have also seen Amy Irvin. She's a great nurse practitioner, knows this space very, very well. She left us and went back into hands-on care and focused with cardiologists back near Nashville, Tennessee. So here is the record where Amy saw me a couple of years ago, and here's her note. Here's the medications, by the way, that I'm on. You remember I have atrial fib, so I'm on Eliquis, I'm on metformin. Remember I started taking pioglitazone a few months ago, and I switched from Crestor to Livalo, or pitavastatin. Those are actually in the summary area. My diagnoses are here. Chronic diagnoses, impaired glucose tolerance, paroxysmal atrial fibrillation. The medications that I'm on, apixaban, metformin, pioglitazone, pitavastatin. Again, back to, I believe this is Amy's visit with, no, let's go back. Let's take a look at, let's move over. And technology is great until it doesn't work, isn't it? Let's go back to Amy's visit. There you go. So this is where Amy and I had a phone conversation, again, with her as the provider, me as the patient. And phone message, spoke with Dr. Brewer this morning, heart rhythm devices at home, noticed paroxysmal atrial fib in the past. 4 weeks ago, episode of atrial fib woke him out of his sleep. Thinks my heart rate was around 150 beats per minute. That's when I saw Amy and I talked with her as the patient after documenting my own atrial fib. So I hope this has been helpful for you in terms of understanding. We're not making stuff up here. This is a real medical practice. But you can only do this. I know the president said, look, we're not going to push on people who are seeing patients out of state. All you have to do is be licensed in the state that you're in. So we may be able to make some concessions for those, 10 states that we're not in. See, the thing is, because of my role as a telemedicine provider for many years and the chief medical officer for large groups, I've got 40 state licenses. I've been able to do this for years for people. They've been they've seen it as a huge improvement of access. So if you're one of those boomers and you're stuck waiting out the coronavirus and you'd like to look into getting a little bit better care, let me just remind you, the doctor's in. Look forward to seeing you. If you'd like to get great medicine right there at home, give us a call at 859-721-1414 or email us at myhealth@prevmedheartrisk.com. Look forward to seeing you then.